Okay, good afternoon everyone. Good afternoon once again. Madungog ko.
Good afternoon, ma'am. Yes, ma'am.
Oy, ako may walay audio. Wait lang. Dili ko kadungog sa inyo. On man. Yun. Sige daw, be. Tingog raw. May isa lang matingog. Dili na ako madungog.
Good afternoon, ma'am.
Good afternoon, ma'am.
Bakit? Dili ko madungog. Wait lang ha. Out sa ako kadali. Sige. Madungog ako?
Yes, ma'am.
Ayun. Ayaw pa nagtingog ako pa. Okay, so it's already 2:40, so 10 minutes na ang nilabay sa atuang scheduled time. You're still mga 69 present. So your attendance is recorded automatically. So I will only check the attendance nga naa sa 2:30 ni sulod, tapos mag-out later 3:30. Okay? So please stay on the line. Okay, so let's start with our discussion with the examples of drugs containing alkaloids. So I need a reaction. Okay na ba? Are you ready to start the discussions? Please send a reaction. Okay. Okay, thank you so much. Okay, let's... Yes, Mr. Cabiladas, na kay question? Na kay, ano? Wala. Okay, sige, let's start. Okay. So first example of drugs containing alkaloids, we have the first class, pyridine and piperidine alkaloids. So pyridine or azobenzene or azine is a heterocyclic aromatic tertiary amine characterized by a 6-membered ring structure composed of 5 carbon atoms and nitrogen, which replaces 1 carbon-hydrogen unit in the benzene ring. So the structure of azabenzene, or what we call as pyridine, is the one on the top. Wait, where is the laser? So this is the structure of pyridine. Then piperidine is a hexahydropyridine, a family of heterocyclic organic compound derived from pyridine through hydrogenation. Managitawag siya og pyridine, piperidine alkaloids because they have the same structure, and which si pyridine, and not si pyridine, si piperidine is a derivative of pyridine. So for the subclass or subgroups of pyridine, piperidine alkaloids, natin mga alkaloidal drugs that are derived from piperidine structure. Example, we have lobeline and arecoline. We have also alkaloids derived from the nicotinic acid and derivatives of both pyridine and piperidine. Such example is nicotine from the tobacco plant. Okay, so first example of, or the plant example of a pyridine, piperidine alkaloids, we have the areca nuts or the betel nuts. So the alkaloidal constituent from these plant, areca catechu, from the dried ripe seed of areca catechu belonging to the family of Palmaceae or Palmae, we have arecoline. So it contains 0.2% of arecoline from the betel nuts. One betel nut contains 0.2% of arecoline. So si arecoline, this is a reduced piperidine derivative. It is used for its anthelmintic, taenifuge, and vermifuge na property, and they are employed in veterinary medicine. So again, in vet med, ginagamit ang areca nuts as an anthelmintic taenifuge, and vermifuge. So the areca nut is also or has an aphrodisiac action. Ginagamit siya as a nerve tonic, especially for those people living in high mountain area or in the mountainous area where the condition or the weather is cold. So para ma-alive sila, ma-stimulated sila, para di sila tugnahon, they chew betel nuts. Or if you're familiar with betel chewing or nganga or mama, kanina betel or kanina plant ang common nila gina-chew. Then, aside from that, ginagamit si areca nuts as an emmenagogue that is useful in urinary disorder. So, aside from arecolin, si areca nut contains 15% of tannin. So, yung tawag sa yan tannin is areca red of flovafin. And aside from arecolin, si areca nuts contains tannins, 15% of tannins termed as areca red of flovafin, which is the responsible constituent for the adverse effect of betel nut chewing, which is this one, the oropharyngeal cancer. Again, the adverse effect of oropharyngeal cancer is caused by the tannin present in the areca nuts. Okay. This is the structure. This is nara ang iyahang nucleus. Ito siya na part. This is the arecolin. Second class of or second example of a pyridine alkaloids, we have lobelia or the Indian tobacco. The dried leaves and tops of lobelia inflata contains lobeline. So it contains 0.4% of lobeline or levolobeline na commonly ginagamit as expectorant, diaphoretic, anti-asthmatic, respiratory stimulant, and one of the ingredients for smoking cessation program or smoking deterrent product used in the smoking cessation program. So para ma-stop ang pag-smoke. Kani ang ginagamit together with nicotine. So example of a preparation that contains lobeline as a smoking deterrent product, we have Bantron na brand. Bantron. So here we have the structure of the pyridine. This one. Then next we have the third source of a pyridine alkaloids. We have tobacco or tobacco. The dried leaves of the Nicotiana tobacco belonging to the family of Solanaceae contains nicotine. So siya ang main alkaloid present in tobacco. That has a sedative, diuretic, sialog, stem activity. It is also employed for its, or has a stimulant activity in the heart and nervous system, na po siya antiseptic property and one of the ingredients of smoking deterrent product. Para di siya mag-withdrawal syndrome. Next, the preparations of nicotine that is employed for smoking cessation program, we have Necoret, ang brand name, Necoret. Okay, second class of constituents, alkaloidal constituents, we have tropane alkaloids, which have an 8-aza bicyclooctane nucleus commonly found in plants of the three families. We have Solanaceae, Erythroxyliaceae, and Convolvulaceae. So the tropane nucleus is a dicyclic compound formed by the condensation of a pyrrolidine precursor, which is the ornithine, with the 3 acetate-derived carbon atoms. And the alkaloids isolated from these families, Solanaceae, Erythroxyliaceae, and Convolvulaceae, they have several legitimate medicinal uses, but they are probably known or best known for their toxic principle. So majority of the constituents aning mga tropane alkaloids are known for their toxic effect. Pero naagid sila legitimate medicinal use. And what are the alkaloids that represents the tropane alkaloid? So we have hyoscyamine, scopolamine, and atropine. tuloka tropane alkaloids. We have hyoscine, atropine, scopolamine, and napaday sa kapat, cocaine. So si tropane alkaloids, they are formerly known as solanaceous alkaloids since majority of the tropane alkaloids are from Solanaceae na family. Okay. So first example of a tropane alkaloid or first source of a tropane alkaloid, we have the belladonna leaf or the deadly nightshade. So the dried leaves and flowering tops of Atropa belladonna belonging to the family of Solanaceae contains these three important constituents. We have hyoscyamine, atropine, and scopolamine, to which si hyoscyamine ang mas daghan compared to atropine and scopolamine. So since these constituents, they has a parasympathetic or anticholinergic property. Ginagamit siya for its spasmolytic activity, which is the most common action of this class of constituents. Spasmolytics. Aside from spasmolytic, na siya narcotic activity, sedative, diba sedative si scopolamine, diuretic, and mydriatic activity. So mydriatic si atropine. Next, we have second source of atropine alkaloid. We have hyoscyamus or henbane. The dried leaves and flowering tops of Hyoscyamus niger belonging to the family of Solanaceae. Same, it contains hyoscyamine, scopolamine, and atropine, to which si hyoscyamine ang mas daghan or taas og composition then compared to scopolamine and atropine. They are employed for their parasympathetic activity, antispasmodic, hypnotic, and maldurative activity. So the allied drug of the henbane or the hyoscyamus is the Egyptian henbane. So this is the structure of the constituents. So nakita na diri ang tropane na structure. This is the nucleus, tropane structure. The third source of atropine alkaloids, we have stramonium or Jameson weed or Jamestown weed from the dried leaves and flowering tops of the Datura stramonium, still belonging to the family of Solanaceae. Present gihapon ang tulo ka constituent. We have hyoscyamine, atropine, and scopolamine or hyoscine. So, kani siya ang highest, followed by scopolamine or hyoscine, and small traces lang of atropine. Ginagamit for its antispasmodic activity. It can relieve spasm of bronchioles in asthma. So, kani si stramonium, it was traditionally used, ginasmoke ang leaves, this part, kaninga part, especially kanina, what do you call the one? Seed. Ginasmoke na siya para ma-relieve ang spasm, bronchospasm. Na-feature ni siya one time sa KMJS. Pangitaan ninyo. Datura metel ang katunaplat. Si talampunay, which is the alternative drugs in the Philippines. Datura metel. And this is the plant to which si hyoscine or asa makuha si hyoscine. If you're familiar with hyoscine, nga naa sa buskupan, hyoscine man na siya. So kani ang source of the hyoscine or scopolamine, the main alkaloid of the Datura metel. Next, the fifth source of atropine alkaloid, we have corkwood or the boycia. From the dried leaves of the Boycia myoparoides, it contains hyoscyamine, atropine, and scopolamine, to which si hyoscyamine ma-convert siya pag through extraction process, ma-convert siya to atropine and scopolamine. So kung i-extract na i-process na si dried leaves, kanilang imong makuha na constituents, the two constituents, atropine and scopolamine. So this plant is considered as the commercial source of atropine. Commercial source of atropine and scopolamine. Next, we have the withania from the dried roots of Withania somnifera belonging to the family of Solanaceae. So the chemical constituents still, you have hyoscyamine, atropine, and scopolamine, to which si atropine and scopolamine lang gihapon nimong ma-extract since si hyoscyamine is converted to atropine and scopolamine upon extraction process and considered also as a commercial source of atropine. Yes. Okay. Next, we have here the atropine alkaloids. Atropine, the summary of their characteristics. The atropine, it is a colorless needle-like crystals or as a white crystalline powder that is optically inactive. Scopolamine is a base resembling tropine, which is almost colorless, syrupy liquid that is particularly abundant in the Tura plants. Then we have hyoscyamine. This is the tropine ester of tropic acid and is readily hydrolyzed by boiling in dilute acids or alkali. So what's their uses? You have si atropine, they are antispasmodic, anti-sialog, mydriatic, encyclopedic. Ginagamit po siya antidote for poisoning caused by cholinesterase inhibitors and has a positive inotropic activity. For scopolamine, ginagamit siya in treatment of motion sickness, pre-anesthetic sedation, and for obstetric amnesia in conjunction with analgesics and to calm delirium. For hyoscyamines, they are employed for its anticholinergic activity, aid in control of gastric secretion, visceral spasm, hypermotility, and abdominal cramps. So, sila gid ang mga famous alkaloids that belongings to tropane alkaloid. So ako lang i-discuss further this atropine, which is common, that causes atropine toxicity. So if you have discussed already this in pharmacology, then it's good. So ato lang i-review gamay din sa pharmacognosy. The toxicity of atropine. So we call it as Alice in Wonderland syndrome or Alice in Wonderland constellation. So, pamintag hot as a hair or hot as a hell. Di ba, ang kabaliktaran? What's the effect of atropine if you are, na-discuss na ni sa pharmacology. Di ba, atropine is it's a anticholinergic agent, right? So, kabaliktaran sa dumbbells ang effect or toxicity ni atropine. Familiar mo with dumbbells? Ang diarrhea, urination, meiosis, bradycardia. So kabaliktaran, muna siya ang effect or toxicity ni atropine. So again, we call it as Alice in Wonderland constellation or Alice in Wonderland syndrome. Hot as a hair or hot as a hell because hyperthermia. Increases hyperthermia, so hot kayo ka. Second, red as a beet. So si atropine can cause vasodilation. So dilation man niyang effect. It causes vasodilation. So nagdilate ang vessels, taas ang blood flow. So mag-red gid siya. So you may notice in the picture na ay red vessels there. So it causes blushing. So red as a beet. Dry as a bone. Dry as a bone. There is decreased exocrine gland secretion. So, dili ka mag-salivate, dili ka makai. So, dry gid kay mong feeling. Absent. Dry ang feeling. Thirsty and all. So, dry as a beet. Then we have full as a flask. Full as a flask kay mag-urinary retention. So, dili ka makaihi. Full imong bladder. Then blind as a bat, since atropine can cause dilation of the pupils, so mydriatic, so it can cause not blindness, mag-dilate man imong mata ay mohang pupil, so less ang vision or cyclopedia, blindness of bat. Then we have mad as a hatter. So unsa man si hatter sa Alice in Wonderland, diba? Naa siya, yun sa iyahang manifestation. Confusion, di ba? There is confusion, there is agitation, naay active psychoreaction, and seizure, kaning MADA sa hatter. So those are mga clinical manifestations of atropine toxicity. Next, we have mandragora. Balikan na lang. Belladonna kay naay Hunger Games na salida. Si atropine na ay Alice in Wonderland na salida. Next one, this one, si mandragora is sa Harry Potter na salida. Okay, the mandragora or the European mandrake, the dried roots of the Mandragora officinarum contains mandragorine, which is employed as a potent emetic. So if you're familiar with the mandragora, katong mandrake nga gibot ni Harry, katong sa salidan Harry Potter. Okay, next we have coca leaves or the coca, which is the divine plant of the Incas. The divine plant of the Incas. Coca leaves from the Erythrocylon coca or Erythrocylon troxylense contains the alkaloid cocaine. So muna siya ang 100 kilogram of the coca leaves is the starting point to extract cocaine. Pero gamay ra kaya makuha from 100 kilogram of the cocaine from the natural source. So what's the use of, or unsay effect, not use, what's the action of cocaine? So it is a CNN stimulant, hallucinating agent, local anesthetic, has a local anesthetic activity, can cause dopamine reuptake inhibition, and has a strong abuse potential. So that can cause behavioral changes kung makatira og cocaine. So that's the action of cocaine. Next, the third example or third class of analkaloidal drugs, we have the quinoline alkaloids. So this is the structure of the nucleus of quinoline alkaloids. The alkaloids containing quinoline as their basic nucleus include those from the cinchona plant. So we have quinconine, quinconidine, quinine, and quinidine, to which quinconine, which is an isomeric with quinconidine, is the parent alkaloid of the quinine series. So the quinconine ang parent alkaloid of this class of constituents. So the only source of the quinoline alkaloids, we have the cinchona or the Peruvian bark, or also termed as counties or Jesuit bark. Again, cinchona is also termed as counties, Jesuit bark, and Peruvian bark. Na nagitawag siya counties because the use of the cinchona bark was na-discover siya tungod kay gigamit siya to treat the wife of the viceroy sa Spain. So the counties natambalan tungod ani na bark. Nagitawag sa o counties. Then nga gitawag siya Jesuit bark because the Jesuit people ang nagdala sa plant to that area or lugar. That's the story. Okay, from the four constituents is from the dried bark of the stem or root of the cinchona sucerubra, or from the cinchona calisaya. The sucerubra is the red quinine or cinchona bark, and the calisaya is the yellow. The constituents, you have quinconine, quinidine, quinine, and quinidine. Next. So what's the use of the cinchona alkaloids? It is used for its anti-malaria, the quinine series, anti-arrhythmia, the quinidine series, and also employed in anti-rheumatism and neuralgia. Ever there is an adverse effect of with the use of the cinchona drugs, it can cause quinconism. So unsay naa sa what's the clinical manifestation, the triad of quinconism. So there is tinnitus or ringing of the ears, impaired vision or dizziness. Then you have also hearing loss or loss of hearing. So tulo ang triad or the classic clinical manifestation of quinconism. Again, tinnitus or ringing of the ear, hearing loss, and impaired vision or dizziness na ang naasa quinconism. So alternative drug for cinchona is the cupria bark or the Remihia pedopeculatum. The quinine describe the two constituents of the quinquina alkaloids. The quinine is the diastereoisomer of quinidine, which is employed as an anti-malaria. So, sa iyahang mechanism of action, there is intercalation of the quinoline moiety into the DNA of the Plasmodium parasites. For the quinidine, which is the anti-arrhythmic drug, it is a stereoisomer of quinine and it is present in cinchona barks to the extent of 0.25 to 1.25%. So the mechanism of action of quinidine as an anti-arrhythmic drug, it depresses the myocardial excitability, conduction velocity, and to lesser extent, the excitability of the heart. Probably ma-excite masyado, quinidine, yan i-depress ang muscle. Next, we have fourth class of alkaloidal drugs. We have the isoquinoline. So as you may notice in the structure, iso na siya sa iso dapit. So balik ta sa, quinine. Ano man to? Here. So nara sa quinoline na alkaloid, there nakaposition ang nitrogen. Pag abot sa iso, na siya sa side. Isoquinoline alkaloids. So mga isoquinoline alkaloids are a double carbon ring containing one nitrogen atom. And the important drugs under alkaloids in these groups are emmetine from Ipecac plant, hydrastin from Hydrastis na plant, sanguinarine from Sanguinaria, tobocurarin from curare plant, berberine, and mga opium alkaloids. So the precursor, di na siya wala na ako na-edit. The precursor of isoquinoline alkaloids are tyrosine for morphine and phenylalanine. So the precursors of isoquinoline alkaloids are tyrosine for morphine and phenylalanine. Okay. So first example, first source of an isoquinoline alkaloids, we have Ipecac. The emmetine, cephaeline, and cyclotrine is obtained from the dried rhizome of Cephalus ipecacuanha or from the Cephalus acuminata. Si emmetine is the active alkaloid. So sa ilahan tulo, si emmetine ang active. 2 to 3% of the alkaloid ang makuha sa rhizome. Emmetine is also termed as methylcephaeline. So pag si cephaeline mag-undergo methylation process, mahimo siyang emmetine. Next, what's the use of emmetine? Ginagamit siya as antidote for poisoning for its emetic property. So iyahang i-decontaminate ang poison by pagawas niya, gastric lavage. Pagawas niya, emmetine. It is also employed for its anti-protozoan activity. Diba na siya sa Ipecac syrup? Itong na-discuss nato sa DDS. Then, diaphoretic and expectorant. So we have preparations of Ipecac. We have Ipecac fluid extract, which is 14 times more potent than the Ipecac syrup, and the Dover's powder, which contains an opium commonly employed as diaphoretic. Then we have Hydrastis or the golden seal. We can obtain hydrastin, berberine, and canadine, to which hydrastin is the most important alkaloidal drug from Hydrastis canadensis. Kinagamit si hydrastin as astringent. Hydrastin is employed as astringent in the inflammation of mucous membrane. Next, we have sanguinaria or the blood root. From Sanguinaria canadensis, it contains sanguinarine, chylirithrin, protopin, and allocryptopin. So si sanguinarine from blood root, so yung color is reddish. Reddish salt ang iyang physical form. Rednessy, sanguinarine, while chylirithrin is yellowish. Si protopin and allocryptopins, they are colorless na mga alkaloids. Again, this one is red yung color. Pag i-obtain, si clarithrine is yellow, then the rest is colorless. But, mo-colored siya pag in salt form. Colored salts. So what's the use of sangenarine? Ginagamit siya as a stimulating or has a stimulating expectorant activity. Emetic po siya at 125 mg. So same with emethine, sangenarine is employed for its emetic activity. Only lang ang dose is at 125 mg. Next, we have curare or the South American arrow poison. It contains dextrotobeucurarine from the dried extract of the bark and stem of Strychnus castellanii. So what's the active? This is the most important constituent, or also termed as curarine. So shortcut, curarine or dextrotobeucurarine. Aside from this one, it also contains calabash curarine 1 and 2. Siya ang pinaka-important. So what's the activity of tobeucurarine? Actually, si tobeucurarine is considered as toxic principle. So this is a quaternary compound that contains a bis-benzyl isoquinoline structure. So nara ang structure niya. Duha iyang quinoline, isoquinoline structure. It exhibits a paralyzing effect on voluntary muscles. So ginatawag siya og curariform effect. By how can it causes paralysis? By blocking the nerve impulses to the skeletal muscles at the myoneural junction. Maniyahang toxic or pharmacologic activity. So despite na toxic na siya, at small doses, ginagamit ang tobeucurarine for the treatment of hydrophobia. So kanang hadlo ko water, cholera, and tetanus. Ginagamit as a muscle relaxant in surgery, control convulsion of the strychnine, poisoning, and tetanus, and as a diagnostic agent in myasthenia gravis. So the allied drug of tobeucurarine or the curare plant, we have the condodendron tomentosum. Okay, pronouncing it. Okay, so the tests used to determine the potency of tobeucurarine is termed as head drop assay that is conducted sa rabbit. So the head drop assay in the rabbit has been employed for the biological determination of the potency of curare, having an onset and duration of action. So the end point of these tests is the head drop. So the administration of the tobeucurarine is gina-inject siya sa liog sa rabbit. So pag nag-drop na ang yang head, dili na gid niya ma-raise up. That's the end point of the test. So relaxation of the neck muscle to such degree that the animal's head cannot be raised or turned in response to a physical stimulus. Next, we have the opium alkaloids. Tawag siyang mga opium alkaloids because there are a lot of alkaloidal drugs makuha ani na plant. Okay. So from the air-dried milky exudate obtained by incising the unripe poppy seed of the capsules Papaver somniferum belonging to the family of Papaveraceae. So the cultivation of this plant is controlled internationally by the International Narcotics Control Board of the United Nations. And the only legit or illicit country that is allowed to cultivate this plant is India. It's India. Okay. So what are the opium alkaloids or opium alkaloids? We have morphine, codeine, noscapine, papaverine, and thebaine. These are the constituents that is taken or extracted from this plant. The opium poppy seed. So we have also the preparations containing opium alkaloids. We have powdered opium, paregoric or the camphorated opium tincture. We have laudanum or opium tincture or deodorized opium tincture. Okay. So we have also mga semi-synthetic or synthetic of opium alkaloids termed as opioids. So mga natural opium alkaloids, they are termed as opiates. Again, these are opiates pag natural, pag semi-synthetic to synthetic, they are termed as opioids. So the opiates, morphine, codeine, noscapine, cataverin, and tebane, and the semi-synthetics or opioids are diacetylmorphine, hydromorphine, apomorphine, and hydrocodone. First, for morphine, this is a phenanthrene derivatives, and the molecule contains a phenolic and an alcoholic hydroxyl group na ginagamit for its narcotic analgesic and strongly hypnotic property. So the recommended dose of morphine as a narcotic analgesic, 10 milligrams 6 times a day, PRN or as needed. However, the side effects of morphine, it can cause nausea and vomiting, constipation, and is habit formation kasi narcotic man siya. Okay. So next we have codeine. Codeine is obtained from opium or prepared from methylation of morphine or from tebane by reduction and demethylation. So add lang ka og methyl group sa structure. So as you may notice here, this is the original, this is the structure of morphine. Pag imuha ni siya, undergo ni siya og methylation, mahimo siya og codeine, diri ma-change ang iyang structure. Nag-add siya og methyl group. Codeine kani na-change diri from morphine. Okay? So what's the use of codeine? Ginagamit siya for its narcotic analgesics plus sedative antitussive activity. So pag analgesic lang kaniyang recommended dose, 15 to 60 milligrams every 4 hours. Pag antitussive yung property, the dose is 10 to 20 milligrams every 4 to 6 hours. The advantage of codeine over morphine is that they are less toxic and less yahang habit formation compared to morphine. Then we have noscapine. Tawag siya noscapine because it possesses no narcotic properties. So noscapine, no narcotic properties, or also termed as anarcotin. The noscapine is employed for its antitussive property, employed or administered IM or sub-Q with a dose of 5 to 20 milligrams every 4 to 5 hours. Narcotin, anarcotin, or noscapine ang iyang name. Next, we have the papaverine. The use of papaverine is a smooth muscle relaxant can be administered orally or intramuscularly. For 150 milligram pag oral, 30 milligram pag IM for its muscle relaxant activity. For antitussive property, the dose is 15 milligram. Then opiates. For the opiates, we have diacetylmorphine or heroin, which is formed by the acetylation of morphine, to which the hydrogen atoms of both the phenolic and alcoholic hydroxyl groups are replaced with acetyl group. So sa morphine, di ba, OH din both. OH din ni, OH din ni. So by acetylation process, they replace ang hydroxyl group og acetyl group. So kanina ang na-replace. These are the acetyl groups. Diacetyl, mananduha, diacetylmorphine. So the disadvantage of this one, yan dili siya ginagamit in medicinally because it is very potent and they are thus increase in danger of habit formation. So maka-addict si diacetylmorphine, mananggiban ang paggamit ni heroin for its medicinal value. Next, we have the hydromorphone or dihydromorphine. The 1-hydroxyl groups of morphine is replaced by a ketone group in the adjacent double bond is removed. So asa man siya nag-differ kay morphine na structure, diri na par. OH man siya kay morphine. Then ketone group ang gibutang. So the advantage of this preparation compared to morphine is that the dosage is smaller than of morphine and less side effect of nausea, constipation, and habit forming. The use and dose, it is a powerful narcotic analgesics that tend to strongly depresses the respiratory mechanism. So 2 milligrams every 4 hours as needed. So mas less ang iyahang dose compared to morphine. And we have the apomorphine form when morphine is treated with hydrochloric acid in sealed tube and 1 molecule of water is lost. The stability of this preparation is they decomposes readily and must be rejected if there is an emerald green color is produced and when it is shaken with distilled waters. We have available man na preparation of apomorphine. So pag naana siya emerald green color, reject na gid siya kay na siya pwede. So the use of apomorphine, it is an emetic in case of poisoning with a dose of 100 micrograms per kilogram body weight subcutaneously, maximum of 6 milligrams. And we have hydrocodone or dihydrocodeine. The ketone group replaces one of the hydroxyl group and the adjacent double bond is saturated. So sa codeine na structure, dili gyapon ang iyahang gi-change. Ketone group is replaced. So siya ang antitussive. Katong kay codeine, sedative, antitussive. This one is antitussive lang siya, particularly useful pag sa troubled cough. Kanang dry cough na sila kag ubo. We have the dose is 5 to 10 milligrams. Then we have the indole alkaloids. The third class of fifth pala. Fifth class of alkaloids, the indole alkaloids or the 1H indole. It is a benzopyrrole in which the benzene and the pyrrole rings are connected through 2 and 3 positions of the pyrrole ring. And the important alkaloids that possesses an indole ring as part of their structures are strychnine and brucine from the Nox vomica, physostigmine, rauwolfia, you have serpentina, you have the vinca alkaloids, vinblastine and vincrestine, and the ergot alkaloids, we have ergotamine and ergonabine. So for the indole alkaloids, 320, we will continue with the indole alkaloids next meeting, which is on April 11. Okay, wala classes April 10. So we will be discussing indole alkaloids face-to-face on April 11. So our quiz, pagbalik yun sa klase, starts from the introduction of the alkaloids, taman ani. Taman sa mga opioids and opiates. Okay? Questions, clarifications, wait lang. Stop sharing. None so far. Okay. Sa yung mga side. How about sa side sa uban? Okay, none. Sige. If klaro na, again, April 11, mag-discuss ta, especially Block A, April 11 kay Tuesday, mag-discuss ta for the continuation of indole alkaloids para mahuman na siya. Then quizzes na rin. Pagbalik ninyo yun, 11 to something, 11 to 15, oras na siya quiz. Continuation, kay gamay na lang man nabilin sa alkaloids. Then every meeting is mag-quiz ko. Basta alkaloids tanan. Okay. Sige, if wala na clarifications, it's already 3:22. Thank you everyone for attending the class. I'll see you on face-to-face next week. Bye everybody.
Thank you, ma'am. Bye, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Bye.